My name is Shtern. I'm a physician and president of the AdMeTech Foundation. AdMeTech is a nonprofit organization leading state, national, and international programs in prostate cancer, advancing patient care and reducing health disparities. My thanks to Tony Clark and Katia Reddick for the opportunity to take part in this event. Sorry, I am not able to join you in person today. Katia Reddick and AdMeTech staff, Thomas Satam, Trisha Keeney, and Emma Coyard, serve as our ambassadors and will be able to assist you today. Dr. Sean Wason described recent advances in prostate cancer screening, diagnosis, and treatment. The focus of my talk is on Prostate Cancer Equity Program, launched recently to bring these advances in patient care to every man in Massachusetts and eliminate health disparities. Prostate Cancer Equity Program is an integral part of the AdMeTech's ongoing statewide program in prostate cancer that created a Massachusetts model of national leadership in public awareness, medical education, and research. Our primary focus is on high-risk men, Black, Hispanic, and Latino individuals, and all men with family history of prostate cancer and increasing age, 50 and above. For public awareness and education, our messaging centered on the importance of screening and early detection, critical for saving lives. Early detection is particularly important for Black, including Hispanic men, who are about 2.5 times more likely to die compared to white men. With early detection of prostate cancer, every man is alive in 5 years. In sharp contrast with late diagnosis, when cancer is spread to other organs, only 28% of men remain alive at the same time. The centerpiece of AdMeTech's medical education is annual Global Summit on Precision Diagnosis and Treatment of Prostate Cancer. The latest 6th annual conference took place in September last year. Our summit has been recognized as a seminal event in shaping the state-of-the-art and future vision for prostate cancer care. Our summit brings together the key international experts representing every clinical expertise involved in patient care to review the best emerging clinical practices. Summit 2022 showed rapid advances in patient care. In screening, our summit supports clinical practice guidelines recommended by the National Comprehensive Cancer Network, consisting of over 28 cancer hospitals and their leading experts. High-risk men, including individuals with Black heritage and with family history of prostate cancer, are recommended to start screening with PSA blood test at the age of 40. Average risk men should start screening at the age of 45. This first, or what we call baseline screening test in younger men, has emerged as one of the most important indicators for identifying men at risk of lethal prostate cancer long-term over more than 10 years. In diagnostics, we have seen emergence of very accurate non-invasive tools such as blood, urine, and saliva analysis for molecular and genetic markers, and advanced imaging, including ultrasound, MRI, and molecular imaging. This non-invasive diagnostics highlighted the importance of PSA screening and shifted past concerns about screening into a dustbin of history. For example, these diagnostics can determine which individual man has an increased risk of life-threatening, rapidly progressing prostate cancer, improve early detection, critical for saving lives, reduce unnecessary procedures such as biopsies and treatment, and optimize selection of personalized care for each man, including careful observation, what we call active surveillance, minimally invasive interventions, or immediate radical treatment. High-risk individuals, including Black men, carry higher risk of both mortality and unnecessary procedures. Consequently, it is critical for them to have access to precision diagnostics that determine for each individual if he should or should not have invasive biopsy or treatment, and what options in clinical care are best for him. Unfortunately, in Massachusetts, compared to white men, Black men are less likely to have precision diagnostics such as advanced imaging, MRI or molecular imaging, molecular or genetic testing, and to undergo life-saving treatment. Prior to undergoing invasive biopsy or treatment, it is important for each man to discuss with his doctor if any non-invasive testing is available to determine if these procedures are actually needed, and if yes, what kind of options would work best for him. Our summit concluded that equal access to high-quality care is the key factor in improving patient outcomes for all men and eliminating health disparities in Black men. It is particularly important now with so many novel diagnostic and therapeutic approaches ensuring high-quality, personalized patient care. Without equal access to these advances in patient care, we will see a widening gap in health inequalities, including survival and mortality. Consequently, AdMeTech launched the Prostate Cancer Equity Program in Massachusetts in collaboration with Mass General Brigham, UMass, and other clinical institutions, with the mission to save lives and deliver high-quality care. Supporting organizations include Latino Health Insurance Program and NAACP New England Area Conference, with their multiple branches located across the state. Our goal is to expedite access to leading experts who use the most advanced approaches to screening, diagnosis, and treatment available today, and support men every step of their medical journey. This program helps men to find an expert for the initial or a second opinion in person or virtual visits. Any Massachusetts man age 40 and older can take part. Our priority focus is on Black, Hispanic, and Latino men who are at high risk of prostate cancer, delayed diagnosis, poor quality care, and death. We believe that in Massachusetts, with its leading hospitals and universal access to care, our prostate cancer equity program will be able to eliminate health disparities. Experts of the Prostate Cancer Equity Program can address any questions about prostate health, from assessing an individual healthy man's personal risk of prostate cancer to informing men about all available options before and after screening, biopsies, and treatment. We are committed to supporting men during every step of their medical journey to ensure that no man is left behind or struggling alone. To achieve this goal, we created a streamlined VIP-style process of patient referral and care, reflecting how doctors involved in this program take care of our families and friends. This process consists of three components. First, AdMeTech Foundation Administrative Coordinator collects basic information and matches individual patients' needs with the experienced nurse for patient education and the appropriate state's experts for clinical care. Second, a clinical organization designates a patient navigator who works with multiple schedulers to expedite a medical visit and related needs, including registration into healthcare system, transportation, and financial assistance if needed. Third, if an expert recommends any next steps, AdMeTech's coordinator, educator, and patient navigator work with patients on the appropriate follow-up, such as, for example, testing or treatment. Risha Kinney, a member of the AdMeTech Foundation staff, serves as a statewide coordinator for the Prostate Cancer Equity Program. She is here with you today to invite you to consider taking part in the Prostate Cancer Equity Program and address any questions you may have. She will be assisted by Thomas Satam and Emma Coyard on our staff. Thank you for your attention.